Dr. Rosen in the movie A Beautiful Mind said, "The nightmare of schizophrenia is not knowing what's true. Imagine if you suddenly learned that the people, the places, and the moments most important to you were not gone, not dead, but worse, had never been. What kind of hell would that be? To give everyone a better idea of this terrible disease, I would like everyone to close their eyes." Now open your eyes and think about what it would be like to hear that all the time. How would you know what reality was versus what was in your head? This is what people with schizophrenia face every day. Being close to a family that has suffered the loss of someone with schizophrenia, I've learned much about battling this disease. Schizophrenia does not discriminate. It strikes all ages and all walks of life, so anyone can be diagnosed with it. Many people do not know the characteristics of schizophrenia, so my goal is to inform everyone about the horrors of this disease. Throughout my speech, you will learn what schizophrenia is, the symptoms, how it became what it is today, treatment options, and how they are diagnosed. Let's begin by looking at what schizophrenia is. Out of all the mental illnesses, schizophrenia is often called the most devastating. The World Federation for Mental Health stated, "Worldwide burden of mental illness is great, but schizophrenia is by far the most debilitating, yet least understood." So what is this monster of a disease exactly? The National Institute of Mental Health defines schizophrenia as a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. Symptoms of schizophrenia can be placed into 3 categories: positive, negative, and cognitive, according to Living with Schizophrenia. Positive symptoms are the hallmark of the disease. Rather than positive referring to good things, in this case, it refers to the usual presence in the schizophrenic mind. Symptoms are delusions and hallucinations and are far beyond the person's voluntary control. Negative symptoms refer to what is missing, specifically the absence of thought or feelings. Cognitive symptoms are changes in a person's ability to function or remember. Sufferers begin to show a diminished ability to process thought, make decisions, and focus. While there is much to learn about this disease and what it is like, first, how did we get to where we are today? While it is seen as far back as biblical times, mostly it was referred to as madness or possession, until schizophrenia was discovered by Dr. Emil Kraepelin in 1896 when he distinguished the disease from other psychotic disorders. His discovery sparked the world's help for the diseased, meaning mental asylums became home to thousands of patients. Sadly, men and women at these asylums endured many years of abusive and sadistic treatment from their caretakers, receiving operations like lobotomy, castration, and electric shock therapy. One of the biggest challenges for individuals with schizophrenia in history was the Nazi regime in the 1930s, when the Charitable Foundation for Curative and Institutional Care was set forth. Their goal? To eradicate schizophrenia from the population by lethal injection until the more efficient gas chambers came along. By the end of World War II, the program had claimed the lives of nearly 250,000 people. After the war, in 1950, the first sane treatment plan was released, known as antipsychotics. However, these breakthrough drugs were extremely hazardous, leading to a considerably reduced quality of life. Unfortunately, this can still be said about the medications used for treating schizophrenia today. Now, schizophrenia is treated with medications and psychotherapy. While psychotherapy has been proven to be useful in treatment, the antipsychotics often create more of a problem than patients are willing to face. In fact, Dr. Reddy and Dr. Kishfran reported in their book, as many as 75% of all schizophrenia patients stop taking their medicine within only 2 years of starting. Typically, side effects are to blame, like seizures, confusion, behavioral problems, loss of bladder control, and sedation, none of which are uncommon. At this point, you may be wondering, what causes this disease? Well, that's the problem. No official cause has been identified. Living with Schizophrenia states that no one knows what causes schizophrenia, and it was written by doctors. Schizophrenia is partly genetics, but only in a part. One of the hardest things about having schizophrenia is being diagnosed. There are no definitive tests for this disease to date. Instead, professionals rely on ruling out other similar conditions first. Often, schizophrenia is confused with multiple personality disorder. Dr. Ellen Sachs, professor of law, psychiatry, and psychology, said whatever schizophrenia is, it is not split personality. The schizophrenic mind is not split, but shattered. Now that you have learned what schizophrenia is, it will be easier to understand what these people go through in everyday life. You've learned what schizophrenia is, how it affects people, how it became what it is today, what treatment options they have, and how people with schizophrenia are diagnosed. After hearing stories and doing research about someone with schizophrenia, it can easily be said that they are just simply misunderstood.